In today's video, I'm going to be talking a little bit about exercise and physical activity in general. Now, specifically with regards to exercise, I'd like to divide this up into what used to be the old belief and what we now should be thinking of as the new belief according to the latest understanding of pain science. So the old belief has always been that when you have an injury, you should rest. Try to do less activity, try to do less physical exercise, as it were, and be very gentle. That is really an old belief because it's something that is not borne out by the new science. In fact, there are studies to actually say that when you reduce your physical activity, 88% often start to have low mood and are noted to be more depressed. So this is useful in some conditions after surgery where we think that rest is important for a defined period. But in a lot of newer guidelines, especially when you look at guidelines for osteoarthritis, where you have age-related changes in your joints, rest or taking relative inactivity is not recommended at all. So the new belief is actually that we should be keeping as active as possible. And in fact, we are now thinking that it should not be wear and tear like the way we describe in arthritis, but we should be talking about it in the term of wear, flare, and repair, because it means that the joint is constantly changing and altering, and it doesn't have to be the only reason for pain. So it's important that you understand that the new belief is about keeping active, keeping a certain range of movements going on. And in the book, I talk a lot about how the muscle movement is also important and to be ensured through activity. So my most important tips is to first of all understand the difference between nociception and pain. And if you know that you haven't had any significant injury, then you are safe to move. And this movement, it doesn't have to be a defined set of repetitions or a particular type of exercises. In fact, there's one major study, a Cochrane collaboration, that looked at almost 37,000 participants. And they tried to identify a certain specific recommended set of exercises for each painful joint or condition, and we couldn't come up with any recommendations at all. So my suggestion and my second tip is to think about a movement that you can do safely and gradually. And the third tip is to find someone knowledgeable in pain science to coach and give you the confidence if that is part of the problem. Thank you. Hi, I hope you enjoyed that video. If you want to hear and see more, then please click the subscribe button and hit the notifications button so that you'll know when the next video is released.